Today I'll be teaching you about CTE, or chronic traumatic encephalopathy. So what is a concussion? A concussion is a mild traumatic brain injury which is caused by an impact, a hard impact to the head, or a certain type of movement like whiplash. Symptoms of a concussion is memory problems, confusion, feeling sluggish, blurry vision, headache, vomiting, sensitive to noise, and slow reaction. So there are different types of concussions. There's stage 1, stage 2, stage 3. One is a mild concussion that can last even less than 15 minutes long, and you can usually experience a very brief moment of unconsciousness, and this usually lasts for 7 to 10 days. Depends on the person. Like, you need to eat, sleep, and do everything that is necessary to make it better, or it's not going to get better. The next stage is stage 2, which is a moderate concussion, which is you may see unconsciousness maybe in a few people, but not in most, and this will last more than 15 minutes long. Next stage is stage 3. In stage 3, you're going to have loss of consciousness, and you will have brain damage depending on where and how hard the hit was. Let's talk about the history of CTE. The first ever case of CTE was found in Mike Webster, who was a football player, and it was founded by Dr. Bennett Amalu in 2002. So let's talk about Dr. Bennett Amalu. Dr. Bennett Amalu was assigned a patient who died, which was Mike Webster. He was a Hall of Fame center for the Pittsburgh Steelers. Dr. Amalu was a Nigerian physician. He moved to America for college. Then he moved to Pittsburgh to train with a doctor named Cyril Wecht. Dr. Bennett Amalu was born in Nakwa, Nigeria during the Nigerian Civil War. He was the 6th of 7 kids, and when he was 12 years old, he wanted to be an airline pilot. Then when he was 15 years old, he went to the University of Nigeria to study for medical. So let's talk about the discovery of CTE. Dr. Bennett Amalu was looking at Mike Webster's brain because at 50 years old, he died from a heart attack. When he was looking at Mike Webster's brain, there was balls of tau proteins clogged up in his brain. So basically, NFL actually denied papers that Dr. Amalu sent to the NFL to make it bigger and make it well known. And he had documents from the past, and it was a similar disease, and it was found in boxers. That was found in early 1900s, and they denied all of it. So then he teamed up with the former Steelers physician to forward this information to the public. The ways of getting CTE is not just from a concussion. They are also diagnosed by way of an insane amount of force given when a collision is present. Most of the people diagnosed with CTE had a history of multiple subconcussive head impacts. Subconcussive hit usually happens when it is not treated as a concussion, but is like one, and it has a long-term effect. So let's now talk about 3 cases of CTE in the NFL. First one, Aaron Hernandez. If you didn't know, Aaron Hernandez played for the New England Patriots, and he was a tight end. Aaron Hernandez was said to have the worst case of CTE from anyone in his age class, or anyone in general that played football. He went to commit a murder, then later died in jail from suicide. Next, Mike Webster. Mike Webster was a center who played for the Pittsburgh Steelers. He was inducted into the Hall of Fame. He died at 50 years old from a heart attack, and he was the very first person to be diagnosed with CTE. Dwight Clark was a wide receiver for the 49ers. He had 3 very bad concussions in his career. His first concussion was very bad, and he lost his vision for a little. The next one, he didn't know where he was, and the last time he had a concussion, he didn't know what team was who and where his teammates were.